Hey, Dr. Eller here, and I'm with my medical students. We just finished up a lab on OMM techniques for the head, ears, nose, and throat, EHNT. These are just a few techniques that you can do to treat a patient that is having an upper respiratory illness, URI. And so things to think about would be like sinuses, right? Sinusitis in the frontal sinuses, maxillary sinuses, otitis media, aka earaches, or pharyngitis, sore throat, strep throat kind of stuff. So these are great techniques that will kind of help for all of these. So the first technique is, let's see here, the gall breath technique. So you're gonna come to the side and the patient can be laying down or they can be supine or sitting up, it doesn't matter. But so we're using the technique referenced in the Osteopathic Techniques book by Dr. Sharon Gostowski. So in her version of this, which I do really like to do, is you're gonna contact the posterior aspect of this mandible right here, close to the ear. So with two or three finger pads, you'll contact that. And then you can let the rest of your hand kind of relax on the jaw. So notice I'm literally behind the jaw on the posterior side here. And then I'm just letting my fingertips rest there and rest on the jaw. And I'm gonna stabilize her head with my other hand, okay? So from here, my force is gonna be pushing the jaw forward anteriorly, but it's literally millimeters, it's not much. So you really shouldn't appreciate the jaw moving much. And you're gonna just open your jaw just so slightly. I just wanna make sure you're not clenching, okay? So I get my placement, I rest my hand, and then I just gently pull forward. I'm not forcing the jaw. I'm not trying to really move it that much. I'm just targeting this tympanic tube. This is also called the pharyngotympanic tube pump. And I'm just trying to target that to move a little bit. So the jaw's not really moving, but maybe 2 or 3 millimeters at most. And then this is a pump technique, but it's a slow pump. So really I'm on, 1, 2, 3, off, 1, 2, 3, on, 2, 3, off, 2, 3, and that kind of rhythm. And I would do this for about 2 minutes because this is a lymphatic technique, okay? And you could do both sides if both ears were affected. So the next technique is anterior cervical effleurage. And again, the patient, you're gonna come to one side and you can rotate the head a little bit and you're gonna find this big strappy muscle, the SCM, coming from the ear to the clavicle right there. So there's 2 sets of lymphatic chains, anterior and posterior cervical chain, that run along here draining into the thoracic ducts. And so the lymphatic vessels they're not very pressurized, right? So they'll flatten out if you put too much pressure. So you want your touch to be very light. And I always just kind of do like a galloping motion because we're trying to just push the fluid. We're not trying to shut the vessels down. So I always just do a little horsey motion, especially for my kids. I'll throw in a little horsey sound at the end, right? So it's just little gallops, right? And I'll do this for a minute or so for the anterior, and then you can come behind the SCM muscle and do the same thing posteriorly. And there are some variations of people doing this bilaterally. I just find it puts a lot of stress on my wrist to try to do it both at the same time, so I choose to do it one at a time. Again, this is a lymphatic technique, so you'll do it for 2 minutes. All right, so the next technique is the anterior cervical arches. This is a lymphatic technique, and we are just going to kind of make a C with our hand, and we're gonna find the tracheal cartilage, right? And so more fingers will be on one side than the other, but they'll be on the same side bilaterally. And I like to start kind of high up towards the hyoid, and you're just gently articulating back and forth, left to right, along this cartilage. You want to make sure, especially with your male patients, that you're not resting your hand, especially when you have an Adam's apple, because it can really cause them to want to cough. and they're already probably sick, so you don't want them coughing on you. So you're just gently going back and forth, left to right, and you will do this for about 2 minutes because this is a lymphatic technique. The next one we did, and you might want to go over here for the angle. So the next treatment, which this isn't really a sequence, there's no particular order so far, you could do any of these in this order, is the mandibular release, submandibular release. So this is a myofascial release technique. So this is a direct myofascial technique because we're directly engaging these muscles and taking them to a barrier towards a direction they don't want to go necessarily. Now, the most common thing I see with people who do this is they are applying way too much force. I like to envision this floor of muscle that's just right here along these bones right here, a little canopy here, and all I'm trying to do is engage that just slightly. Any more force than that, you're taking the force into the patient's head and they're going to feel pressure and it's not comfortable, and you're putting pressure here on the TMJs as well, and if you're sick, that's probably not going to feel very well. So try to keep your focus here just on this superficial area, this band of muscles here. So you're going to use your finger pads, find the muscle, engage it anteriorly, so that means or superiorly I should say, so I'm just gently engaging, pushing towards her eyes, finding that muscle, and then I'm going to distract laterally. And at this point, this is good enough. If you want to try to give a little bit more barrier, you can kind of curl your fingers in a little bit, but avoid pushing up further towards her nose. Does that feel good? You might notice one side is more tight than the other. And this is a myofascial release technique, so you would hold this until you feel the tissue starting to release. And if you don't appreciate any release, then you can hold it for up to 2 minutes, and there should be change by then. The next technique is auricular drainage. This can be performed supine, laying down like this, or seated. I'll actually have you do it in a seated position. That's how I do it most commonly. I do this a lot for little kids. Come this way a little bit. So, easy technique. You spock it, right? Because we want our patients to live long and prosper. I'm going to stabilize the head with my other hand, and I'm just doing this nice gentle motion. And there's no particular, it's not super fast, but it's not super slow. It's just a nice even pace. And you'll do this, I'll usually do this for 30 seconds one way and then about 30 seconds the other way. And it doesn't matter which way you start. So this is really good for the patient who has like ear fullness, maybe not a full-on ear infection because this could be a little tender if it's a very bad infection. It just kind of have to play by ear and just see if they can tolerate it or not. But this is really good for when the ear is full with fluid and needs to be drained, or for kids who are flying and they need to equalize the pressure in their ear. Because what this is doing is it's working on all the fascial connections here and also going to help that tympanic membrane drain. Okay, so you could do that one side if it's a one-sided problem, or if it's both, you do it on both sides. Okay, now we come back down. And then what else did we do today? Alternating nasal pressure. So there's a lot of ways to do this technique. This is a lymphatic technique for the sinuses. So some books just have one finger and you're just doing this like that. I just find it's just kind of odd looking. It doesn't feel right. I learned an alternate, which I know is acceptable to use in class, and it's using your thumbs. So I'm going to just gently place the pads of my thumbs at the bridge of the nose right here, and I'm just rocking back and forth like this. Okay, so I'm kind of using my hands as a fulcrum along the face, And that's where most of my pressure is. And then my thumbs are just going back and forth, left to right. And I go until I get to a little bit of cartilage here. I don't go all the way to the tip. I stay here on this side of the nares, and then I work my way back up. So you just find this nice slow rhythm, relaxing rhythm, and you can just work your way up and down the nose here. And you might find one side is easier to put pressure on and another side might be more resistant. Okay. Great technique if you're trying to get the frontal sinuses to drain. Very easy to do. It's a lymphatic technique, so you will do that for 2 minutes. The next is trigeminal stimulation. So this is the trigeminal nerve, and if you remember your anatomy, there's V1. It's usually right in the eyebrows if your eyebrows are real. If they're fake, they might be higher or lower, but they're right around the eyebrow line. So that's V1 branch. V2 is in the infraorbital area right here. So some books might show it down here. That's too low. It's right here in the infraorbital space right there. So you should be able to feel the little tiny foramen, the little tiny holes. And then you have the submental V3 right here. So the most common thing I see students do is they will get in here and they're really mashing, right? That does not look very fun to me. This looks like it might hurt even. It's just too much. Sometimes this can be very tender area, especially if you have a lot of stress or you're just not feeling well. It's already sensitized, and pushing too firmly will not be fun. So I like to just remind my students that the nervous system is always working, it's always aware, it's always monitoring. So even the slightest stimulus, it's going to pick up. So that's just my little tip for, you can be very light and this will still work. You can be so light, and I can just do these nice little circles over that supraorbital foramen. And sometimes you can even appreciate your finger rolling over the supraorbital nerve, okay? And isn't this so much nicer, right? It's just like, it's so much more enjoyable. So I would do that here for at least 30 seconds because we're stimulating this nerve. We're saying, hey, wake up. It's okay. I'm sending in a constant stimulus. And so if it's hyperactive, it might help shut it down. If it's overactive or if it's underactive, it might help wake it up. Here we go. And same thing, very light. Right over that foramen. And then for V3, you can do your fingertips, or you can use your thumbs. And even here, sometimes even though your nails might be short, it might feel like you're poking the skin. You can use your thumbs, which have a little bit more pad. And just be sure you're not putting a lot of force in their face. You're staying very superficial in the subcutaneous tissue. And then submental. Now you just relax, right? Feels really good. If your patient falls asleep, that's a good sign. We're almost there to the end. Let's see here. We have maxillary and frontal drainage, and then we're done. So that's a great segue because we've already done the stimulation part of it. Now we can help drain the sinuses. So for maxillary, you'll see some people using their index fingers. I don't know. It just doesn't, this looks so much better to me. It doesn't matter what finger you're using. Honestly, it's the one that you're most comfortable with, the one that you're most comfortable touching the patient with. If you feel awkward, then it's probably going to feel awkward to the patient. So that's the maxillary sinus. And then for the frontal sinus, right here, just above the eyebrow, and we're coming out. and I'm not pressing very hard. You just want to palpate to the bone. The sinuses are in the bone, right? So I'm not on the skin. I'm not brushing skin. I've palpated through skin, the subcutaneous tissue, into the bone, and I'm just guiding any fluid that's in the sinuses out towards the side. Moving the bone, creating motion in the bone to help facilitate drainage. Because if these bones are not moving, then the sinuses are not draining, and then you're prone to infection. And that's all I have. But there's no particular order for this. Obviously, if you're following a true lymphatic treatment, you want to open the thoracic inlet, and you can work your way from, distal to proximal. So you could start with some more of the face stuff, then the ear stuff, jaw, and then neck. That would be a more proper way to do it. But honestly, just if you only do one or two of these things, your patient's going to be better than having nothing, right? So I hope that was helpful. Thank you.